Mr. Matthews is a 65-year-old male with a history of hypertension and type 2 diabetes. He presents with increasing shortness of breath and swelling in his legs. During the physical examination, you notice elevated jugular venous pressure, JVP, and bilateral pitting edema in the lower extremities. What should be the next step in your diagnostic process? Answer: given Mr. Matthews' history of hypertension, type 2 diabetes, and the symptoms of shortness of breath and leg edema, the first step should be a differential diagnosis to assess for potential heart failure. The elevated JVP and bilateral pitting edema are classic signs of right-sided heart failure, often due to congestive heart failure, CHF. The next step would be to assess the cardiovascular system more closely, potentially including echocardiography to evaluate heart function and assess for any structural issues such as valve diseases or left ventricle dysfunction. B-type natriuretic peptide (BNP) levels, which are often elevated in heart failure. A thorough electrocardiogram to check for arrhythmias or ischemic changes. Chest X-ray to evaluate for pulmonary edema or cardiomegaly. Additionally, it is critical to manage the patient's hypertension and diabetes effectively, as these are risk factors for heart failure. Ensure patient education on medication adherence and lifestyle changes to reduce the progression of heart failure. What are the key differences between palpation and percussion in physical examination, and when would each technique be used during a physical assessment? Answer: both palpation and percussion are physical examination techniques used to gather information about the body, but they differ significantly in approach and purpose. Palpation involves using the hands to feel the body, often to assess areas of tenderness, temperature, texture, and any abnormal masses. There are different types of palpation. Light palpation, to assess surface characteristics such as skin temperature and tenderness. Deep palpation, to assess deeper organs or structures like the abdomen for organ enlargement, masses, or tenderness. When to use palpation: for detecting masses, organ size, and muscle tone, or when checking for signs of inflammation, like in abdominal exams or joint assessments. Percussion involves tapping the body to produce sounds that help assess the underlying structures, particularly air-filled organs like the lungs and hollow organs like the stomach. The sounds produced can indicate normal or abnormal conditions. Resonance: normal lung tissue. Dullness, suggesting solid or fluid-filled areas like the liver. Hyperresonance, indicating conditions like emphysema or pneumothorax. When to use percussion: it is used to assess the lungs, abdomen, and to evaluate organ borders or fluid levels, such as in suspected pleural effusion. MS. Taylor is a 50-year-old woman diagnosed with early-stage osteoarthritis in her knees. After the assessment, a rehabilitation program is recommended. What key elements should be considered when creating an individualized treatment plan for MS? Taylor. Answer: an individualized treatment plan for MS. Taylor with osteoarthritis OA should focus on managing her symptoms and improving functional mobility. The key elements to consider include patient-centered goals. Understand her lifestyle, goals, and expectations. For example, if she is aiming to continue gardening or walking, the treatment plan should help achieve that. Evidence-based interventions, physical therapy, PT, exercises focusing on strengthening the quadriceps and improving joint mobility are essential. This should include low-impact aerobic exercises, e.g. swimming, cycling, to reduce joint stress. Pain management. Options like non-steroidal, anti-inflammatory drugs, NSAIDs, or topical treatments, with consideration for side effects, especially considering her age. Weight management. If overweight, weight reduction can significantly reduce the load on the knee joints. Assistive devices, knee braces, or orthotics to help reduce joint strain. Patient education. Teach about activity modification, including avoiding prolonged standing or high-impact exercises. Encourage a balance between rest and activity to manage flare-ups, monitoring and adjusting. Periodically assess the effectiveness of the treatment plan and make adjustments as needed. What is the purpose of using the history-taking method in clinical assessments, and how can effective history-taking influence treatment outcomes? Answer: history-taking is a critical part of clinical assessments that helps gather detailed information about a patient's health status, risk factors, and symptoms. The key purposes of effective history-taking include identifying key symptoms, helps recognize patterns in symptoms, which are essential for formulating a differential diagnosis, understanding lifestyle factors. A thorough history includes understanding the patient's diet, exercise habits, smoking, and alcohol consumption, which can influence both diagnosis and treatment planning. Identifying risk factors. A patient's medical history, e.g. past surgeries, chronic illnesses like hypertension or diabetes, provides context for assessing the likelihood of certain conditions, e.g. cardiovascular disease, stroke, or kidney disease. Guiding diagnostic testing. History taking helps clinicians decide on the necessary diagnostic tests, e.g., imaging or lab work, which can help in making a timely diagnosis and avoid unnecessary tests. Patient engagement and adherence. Engaging the patient in the history-taking process builds rapport and enhances trust, which can influence adherence to treatment plans. Explain the key principles of patient education in clinical practice and how they contribute to improving treatment adherence. Answer. Patient education is crucial in ensuring that patients understand their condition, the rationale behind prescribed treatments, and how to properly follow through with care instructions. The key principles include clear communication, presenting information in clear, simple language, avoiding medical jargon, active participation, encourage patients to ask questions and express concerns, tailored information. Education should be individualized based on the patient's literacy level, culture, and preferences. Setting realistic expectations. Help the patient understand what the treatment can realistically achieve, managing any unrealistic expectations they may have about rapid results or outcomes. Motivational techniques. Techniques such as motivational interviewing can encourage patients to make behavior changes, such as stopping smoking or improving their diet, by emphasizing personal motivation and long-term health benefits. Effective patient education directly contributes to treatment adherence by ensuring that the patient understands how to properly manage their condition and why it's important for their overall health. What role does monitoring and adjusting treatments play in patient care, and how should a healthcare professional approach this process? Answer. Monitoring and adjusting treatments is essential for optimizing patient outcomes, ensuring that therapies are both effective and safe. This process involves ongoing evaluation, regularly assessing the patient's response to treatment through follow-up visits, tests, and patient feedback. For example, monitoring blood pressure in hypertensive patients to ensure medications are effective, identifying side effects, actively asking patients about any new or worsening symptoms that may indicate adverse drug reactions or complications. Patient involvement, engaging the patient in discussions about how they feel regarding their treatment, allowing them to provide feedback on what works and what doesn't. Adjustments based on evidence. If a treatment plan is not yielding the desired results, or if the patient experiences adverse effects, the clinician must consider adjusting the treatment. This might involve changing medications, modifying dosages, or incorporating complementary therapies. The goal is to ensure that the patient receives the most appropriate and effective care while minimizing the risk of harm or unnecessary treatments. What are the ethical considerations that healthcare professionals must account for when discussing end-of-life care with a patient and their family? Answer. When discussing end-of-life care, healthcare professionals must be sensitive to both ethical principles and patient autonomy. Key ethical considerations include autonomy, respecting the patient's wishes regarding treatment options, including whether they want aggressive interventions or prefer palliative care. This includes ensuring that advanced directives or live-in wills are in place. Beneficence and non-maleficence. The healthcare provider must ensure that they are acting in the best interest of the patient, aiming to alleviate suffering. Beneficence while avoiding harm. Non-maleficence. This might include pain management or transitioning to comfort care rather than pursuing life-prolonging measures. Justice, ensuring fair and equitable treatment for all patients, including respecting their cultural, spiritual, and emotional needs when making decisions about end-of-life care. Communication, providing clear, compassionate communication with the patient and family members, explaining the prognosis, treatment options, and potential outcomes. This involves being honest while also providing emotional support. Cultural sensitivity, understanding that different cultures and religions may have specific beliefs about death and dying, and healthcare providers should respect these views while providing care options that align with those values. Ethical discussions should also consider advanced care planning, ensuring that decisions are made in advance to avoid confusion or distress during critical moments. Describe the relationship between symptom evaluation and differential diagnosis, and how a thorough evaluation can improve clinical outcomes. Answer. Symptom evaluation is the process of collecting and analyzing the patient's reported symptoms, while differential diagnosis is the process of considering all possible conditions that could explain those symptoms. The relationship between the two is integral to accurate and effective diagnosis. Symptom evaluation involves gathering detailed information about the nature, duration, and severity of symptoms. Questions like, when did the symptoms start? Are they constant or intermittent? Help in refining the diagnosis. Differential diagnosis. Based on the symptoms evaluated, the clinician must create a list of possible conditions that could explain the patient's presentation. For example, chest pain might be caused by angina, a myocardial infarction, or a gastrointestinal condition like acid reflux. Clinical decision-making. A well-done symptom evaluation narrows down the potential causes, guiding further testing, imaging, lab tests, improved outcomes. A thorough evaluation ensures that the most appropriate diagnostic tests and treatments are pursued, reducing the likelihood of misdiagnosis and improving treatment efficacy. Explain the importance of behavioral change techniques in healthcare, specifically for patients with chronic conditions like diabetes or hypertension. Answer: behavioral change techniques are crucial in managing chronic conditions like diabetes or hypertension, where lifestyle modifications can significantly impact the patient's health outcomes. Techniques include motivational interviewing. This technique helps clinicians engage patients in a collaborative conversation about their health and treatment options. By exploring ambivalence and encouraging self-reflection, patients are more likely to commit to behavior changes. Goal setting. Helping patients set realistic, achievable goals, e.g., reducing salt intake or increasing physical activity, can promote adherence to treatment plans. Goals should be specific, measurable, attainable, relevant, and time-bound. SMART. Self-monitoring. Encouraging patients to track their own progress, e.g., blood glucose levels or blood pressure, helps improve self-efficacy and reinforces positive behaviors. Cognitive behavioral therapy, CBT. For patients with chronic conditions, addressing underlying thoughts or beliefs about their health can improve adherence to treatment plans. Effective behavioral change interventions lead to better disease management, reduced complications, and enhanced overall quality of life for patients. Why is clinical documentation essential in patient care, and how does it contribute to continuity of care and legal protection for healthcare professionals? Answer: clinical documentation is vital in patient care for several reasons, including legal protection, quality of care, and continuity of care. Legally binding record. Accurate and thorough documentation serves as a legal record of the care provided. In case of disputes or malpractice claims, proper documentation can serve as evidence that appropriate care was provided. Continuity of care. It ensures that all healthcare providers involved in a patient's care, e.g., specialists, nurses, have access to the most current information, reducing the risk of medical errors or redundant testing. For example, if a patient is transferred to a different care team, detailed notes ensure that the new team understands the patient's treatment history. Quality assurance. Clinical notes serve as a tool for reviewing the effectiveness of care and ensuring that evidence-based practices are followed. Well-documented progress notes help in assessing the patient's response to treatment and in planning future care. Communication tool. Documentation ensures effective communication among team members, facilitating coordinated efforts. It also assists in patient education, with written records available for patients to refer back to. A nurse is asked to perform a task that is beyond the scope of practice outlined in their professional standards. What steps should the nurse take to ensure they are complying with legal and regulatory standards? Answer: the nurse must first recognize the limits of their scope of practice as defined by the Health and Care Professions Council (HCC) standards. If the task is beyond their capability or outside their legal scope, the nurse should assess the task. The nurse should evaluate whether the task is within the role-specific responsibilities as defined by their professional guidelines. For example, in the nursing profession, certain medical procedures or diagnostic decisions may require the supervision or delegation of a qualified medical professional. Consult with a supervisor or senior colleague. If unsure, the nurse should seek guidance from a supervisor, manager, or senior healthcare professional who has the authority to make decisions on delegation. Document the decision. It is essential to document any concerns raised and the decisions made, as it provides a clear record that the nurse followed appropriate protocols to ensure patient safety and legal compliance. Delegate responsibly if applicable. If the task can be delegated, the nurse must ensure that the person to whom it is delegated is competent and appropriately trained to perform the task. The HCPC standards explicitly require that health and care professionals work within their scope and only undertake tasks for which they are adequately trained and qualified. HCC 2024. Breaching this can result in disciplinary actions or legal repercussions. Why is accurate and thorough documentation critical in healthcare, and what potential legal implications might arise from inadequate documentation? Answer: accurate documentation is vital for providing a record of care. It ensures that all healthcare activities are properly recorded, offering a clear narrative of the care provided to a patient. This documentation becomes crucial if the care is later called into question or during audits. Legal protection. Inadequate documentation can lead to the inability to defend a clinician's actions in cases of complaints or investigations. It can be used as evidence in court cases or regulatory reviews, such as in instances of professional misconduct or negligence, ensuring continuity of care. Accurate documentation allows other healthcare providers to be aware of the patient's status and history, preventing errors due to lack of information. Failure to document accurately could lead to a situation where the healthcare professional cannot provide evidence of following proper procedures or adhering to standards of care, making them vulnerable to legal actions or disciplinary measures under the HCPC standards and the Health and Safety Act. Mr. Thompson, a healthcare facility manager, notices a significant number of staff reporting symptoms of respiratory illness after working in one particular area of the hospital. He suspects that the air quality in that area is poor and could be contributing to the health problems. What steps should Mr. Thompson take to address this issue according to health and safety regulations? Answer: Mr. Thompson should take the following steps in accordance with health and safety regulations. Immediate action: isolate or limit access to the affected area to protect further staff from exposure. Notify the appropriate health and safety team or occupational health service within the hospital. Conduct a risk assessment. Mr. Thompson should organize a thorough risk assessment of the area, focusing on air quality and identifying potential hazards such as poor ventilation, exposure to hazardous substances, or the presence of toxic particles. Under the Health and Safety at Work Act 1974, employers are legally required to ensure the health and safety of all employees by assessing risks and taking appropriate preventive measures. Implement corrective measures. If the assessment confirms that poor air quality is contributing to respiratory illnesses, Mr. Thompson must implement corrective measures such as improving ventilation, providing appropriate personal protective equipment (PPE), and retraining staff on proper safety procedures. He may also need to consult with external experts like environmental health officers to monitor and rectify the air quality issue. Report and follow up. It is crucial that Mr. Thompson reports the incident to the Health and Care Professions HCC if there is a risk to patient or staff safety. The facility should also keep detailed records of the actions taken and ensure follow-up monitoring. What are the key steps a healthcare professional should follow when reporting suspected abuse, neglect, or misconduct within the healthcare setting, and what are the consequences of failing to report such incidents? Answer: healthcare professionals are legally obligated to report suspected abuse, neglect, or misconduct under various regulations, including the Safeguarding Vulnerable Groups Act 2006 and Children Act 1989. The key steps include immediate reporting. The healthcare professional should immediately inform their supervisor or the relevant safeguarding team within the healthcare setting if the situation is urgent or involves a risk of immediate harm to a vulnerable individual. Reporting to the police or the relevant authorities may also be required. Documentation. All concerns should be documented in a clear, factual manner, ensuring that the report contains all relevant information and observations that may assist in the investigation. Maintain confidentiality. The report must be confidential with access restricted to those who are directly involved in the investigation. The HCPC guidelines stress that confidentiality must be maintained unless there is a lawful basis to disclose the information. Failure to report consequences. Failure to report abuse, neglect, or misconduct could result in disciplinary actions, legal consequences, and harm to the patient. What are the key principles of GDPR that healthcare professionals must adhere to when handling patient data, and how can non-compliance affect a healthcare provider's legal standing? Answer: under the General Data Protection Regulation (GDPR), healthcare professionals are required to adhere to the following key principles: lawfulness, fairness, and transparency. Healthcare professionals must ensure that data collection and processing are lawful and transparent to the patient. Consent must be obtained before processing personal data unless another lawful basis exists. Purpose limitation. Data should only be collected for specific, legitimate purposes and not used for purposes beyond those initially stated. Data minimization. Only the minimum necessary data should be collected to meet the healthcare needs of the patient. Accuracy. Patient data must be kept accurate and up to date. Storage limitation. Data should not be kept for longer than necessary. Confidentiality and security. Healthcare professionals must ensure that patient data is kept secure, including physical security measures and digital protections like encryption. Non-compliance with GDPR can result in significant fines up to €20 million or 4% of annual global turnover, whichever is higher, and reputational damage. What is the role of healthcare professionals in preventing and managing hospital-acquired infections, HIEs, and how do guidelines like the NHS Infection Control Guidance influence their actions? Answer: healthcare professionals are responsible for preventing and managing hospital-acquired infections, HIEs, by adhering to infection control guidelines such as the NHS Infection Control Guidance. Key responsibilities include hand hygiene. Healthcare professionals must follow strict hand hygiene practices before and after patient contact, including using hand sanitizers and washing with soap and water as appropriate. Use of PPE. They should wear appropriate personal protective equipment, PPE, such as gloves, gowns, masks, and eye protection based on the level of infection risk. Environmental cleaning, ensuring that hospital areas are regularly cleaned and sanitized, especially those used by multiple patients, is critical in preventing infection spread. Patient education. Healthcare professionals should educate patients on the importance of hygiene and infection prevention, such as proper wound care and cough etiquette. Failure to follow these guidelines can lead to the spread of HIEs, putting patients at risk and potentially resulting in legal actions or sanctions for negligence. How do healthcare professionals ensure compliance with regulations and standards such as the Health and Safety Act 1974, and what are the consequences of non-compliance in a healthcare setting? Answer: healthcare professionals ensure compliance with the Health and Safety at Work Act 1974 by risk assessment and management, regularly assessing the risks associated with healthcare work environments, including those related to equipment, substances and work practices, training and education, ensuring they are properly trained in health and safety protocols, including emergency procedures, first aid, and safe handling of hazardous substances, adherence to workplace safety standards, complying with established safety standards for the maintenance of equipment and facilities, such as the regular inspection of medical devices and patient care areas, reporting hazards and incidents, promptly reporting any incidents or potential hazards to health and safety officers to prevent further risks. Non-compliance with these regulations can lead to severe consequences, such as legal penalties, insurance claims, and reputational damage, as well as potential harm to patients or staff. What are the core principles of good documentation practice that healthcare professionals must follow, and what are the legal implications if these principles are not adhered to? Answer: good documentation practice in healthcare includes accuracy. Records must be clear, accurate, and free from errors. Timeliness. Documentation should be completed in a timely manner, as delayed records can compromise patient care and legal proceedings. Legibility. Whether written or electronic, records must be legible and easily understood. Confidentiality. Personal patient information should be kept confidential with access restricted to authorized individuals only. Comprehensiveness. All relevant clinical information must be documented, including patient assessments, care plans, treatments, and outcomes. Failure to comply with documentation standards can result in legal consequences, including claims of negligence or professional misconduct, particularly if documentation is required for regulatory investigations or defense in court. What are the key strategies that healthcare workers should employ to control the spread of infection in a hospital setting, and how do these strategies align with the Control of Substances Hazardous to Health (COSH) Regulations 2002? Answer: key strategies for controlling the spread of infection include proper hand hygiene, regular hand washing and sanitizing before and after patient contact, use of personal protective equipment (PPE), wearing gloves, masks, and gowns when required, safe disposal of contaminated materials, ensuring contaminated items such as needles or dressings are disposed of in a safe, regulated manner, environmental cleaning and decontamination, regular cleaning of hospital surfaces, especially those with high patient contact. These practices align with the COSHH Regulations 2002, which require healthcare settings to assess risks from hazardous substances such as infectious agents and put appropriate control measures in place to protect staff and patients. Failure to follow these procedures can result in the spread of infections, which can lead to severe legal and regulatory penalties. How do healthcare professionals ensure the confidentiality of patient information, and what are the legal implications if this confidentiality is breached? Answer: healthcare professionals ensure patient confidentiality by adhering to legal and regulatory standards, following laws such as the Data Protection Act 2018 and General Data Protection Regulation (GDPR) that mandate strict guidelines for handling patient information, limiting access to information. Only authorized personnel should access patient data, and this access should be logged and monitored. Secure storage of patient records, ensuring that both physical and electronic patient records are stored securely with appropriate encryption for digital data. Educating staff. Regular training on confidentiality and the importance of maintaining patient privacy, including the consequences of breaching confidentiality. Breaching patient confidentiality can lead to severe legal consequences, including fines, loss of professional license, and potential criminal charges. In addition, it may damage the trust between the healthcare provider and the patient, which can significantly affect the care provided. In a healthcare setting, risk identification and mitigation are crucial for patient safety. What steps should a healthcare professional take to effectively identify and mitigate potential risks in the workplace? Discuss the role of safety procedures and how they contribute to preventing harm to patients and staff. Answer: effective risk identification begins with conducting a thorough risk assessment. This should include both physical risks, such as environmental hazards, and procedural risks, such as errors in medical treatments. Healthcare professionals should utilize a combination of routine safety checks, patient feedback, and incident reporting mechanisms to continuously identify potential risks. Safety procedures such as infection control protocols, emergency evacuation plans, and equipment maintenance schedules are essential in reducing the likelihood of risk exposure. Furthermore, the Health and Care Professions Council (HCC) emphasizes the importance of compliance with professional standards, ensuring that healthcare providers uphold policies that reduce risks to patients. The General Medical Council (DMC) and Care Quality Commission (CSC) provide additional frameworks for safety standards, ensuring that proper risk mitigation techniques are in place. Ultimately, mitigation strategies involve early intervention through training, use of personal protective equipment (PPE), regular monitoring, and root cause analysis following incidents. A nurse in a hospital reports a near-miss incident where a medication was almost administered incorrectly. According to HCPC guidelines, what steps should be followed to ensure that this incident is properly reported and analyzed to prevent recurrence? Answer: the HCPC guidelines stress the importance of incident reporting and a systematic approach to learning from such incidents. The following steps should be taken. Immediate reporting. The incident must be immediately reported using the hospital's established reporting channels, e.g., incident management system. Root cause analysis. A comprehensive root cause analysis should follow to investigate the contributing factors that led to the near miss. Implement corrective actions. Based on the findings, the organization should implement corrective measures such as additional staff training, changes to the medication administration procedure, or improvements to communication practices. Follow-up. Ongoing monitoring should ensure that the corrective measures are effective in reducing the risk of a similar incident. The NHS Resolution and Nursing and Midwifery Council (NMC) guidelines outline a transparent and supportive approach to reporting incidents, ensuring that healthcare professionals are not penalized for reporting near misses, but rather are encouraged to participate in safety improvement initiatives. Mr. Williams is a healthcare worker in an outpatient clinic. He has just treated a patient who is showing symptoms of a highly contagious infection. The patient is not yet diagnosed but has been placed in a general treatment area. What immediate steps should Mr. Williams take to prevent the potential spread of infection, and what protocols should be followed according to standard infection control guidelines? Answer: Mr. Williams must immediately follow the standard precautions for infection control, which include hand hygiene. Mr. Williams should perform hand hygiene before and after patient contact using soap and water or hand sanitizers if hands are not visibly soiled. Personal protective equipment (PPE). Mr. Williams should use the appropriate PPE, including gloves, gown, mask, and eye protection based on the clinical scenario and the nature of the suspected infection. Isolation protocols. Given the contagious nature of the symptoms, Mr. Williams should immediately request that the patient be placed in an isolation area while awaiting diagnosis. Isolation should follow the transmission-based precautions, e.g., contact, droplet, or airborne precautions based on the suspected infection type. Environmental controls. Surfaces in the treatment area should be disinfected using hospital-grade disinfectants, especially after patient contact. In accordance with guidelines from the World Health Organization, WHO, and the Centers for Disease Control and Prevention (CDC), these steps aim to minimize the risk of cross-contamination and protect both patients and healthcare workers. Human errors in healthcare can lead to significant risks for patient safety. What strategies can healthcare professionals implement to minimize errors in high-pressure environments, and how do these strategies align with HCPC's patient safety principles? Answer: healthcare professionals can minimize errors in high-pressure environments by implementing the following strategies. Standardized protocols. Establishing clear, standardized clinical protocols for common procedures, such as medication administration or patient transfers, helps reduce the potential for human error. Team communication. Fostering open communication within multidisciplinary teams is essential. The SBAR situation, background, assessment, and recommendation technique is often used for structured handovers, reducing communication failures. Human factors training. Healthcare professionals should be trained in recognizing cognitive biases, stress, fatigue, and other factors that contribute to errors. Automation and decision support, where appropriate, introducing technological solutions like computerized physician order entry, CPO systems, or decision support tools can help prevent errors by automating routine tasks and providing real-time alerts. These strategies align with HCPC's guidelines on maintaining patient safety, ensuring a systemic approach that reduces reliance on individual memory and decision-making and encourages the use of tools and procedures that enhance safety. A healthcare worker is about to treat a patient diagnosed with a highly contagious airborne infection. According to isolation protocols, what specific precautions must the healthcare worker take to prevent the spread of the infection, and which healthcare settings are typically required to implement such measures? Answer: isolation protocols for airborne infections, such as tuberculosis or measles, involve the following precautions. Isolation room. The patient must be placed in a negative pressure room, which is designed to contain airborne pathogens and prevent their spread. The room should have a ventilation system that filters the air before it is released outside the facility. Personal protective equipment (PPE). The healthcare worker must wear a high-efficiency particulate air HEPA mask or respirator to prevent inhaling airborne pathogens. Standard gloves, gowns, and eye protection should also be worn. Patient movement. The patient should be restricted to their isolation room and should wear a surgical mask if they need to be moved for medical procedures. Environmental controls. The area should be regularly cleaned and disinfected, with particular attention to surfaces that may have come into contact with respiratory droplets. Hospitals, tuberculosis clinics, and other healthcare settings that treat patients with known or suspected airborne diseases are required to implement these protocols as outlined by the CDC and WHO. What are the key infection control measures that should be followed during surgical procedures to minimize the risk of surgical site infections according to standard infection control practices? Answer: key infection control measures during surgical procedures include sterile technique. All instruments used during surgery must be sterile and the surgical team must maintain a sterile field throughout the procedure. This includes the use of sterile gloves, drapes, and surgical instruments. Hand hygiene. Surgical personnel must perform thorough hand hygiene before donning gloves. This includes washing hands with antiseptic soap and water, followed by the use of alcohol-based hand rubs. Antiseptic skin preparation. The patient's skin at the surgical site must be cleaned using an appropriate antiseptic agent, such as chlorhexidine or iodine-based solutions, to reduce microbial contamination. Antibiotic prophylaxis. In some cases, prophylactic antibiotics may be administered prior to surgery to reduce the risk of postoperative infections, especially for high-risk surgeries. These practices are mandated by guidelines set forth by the CDC and Association of Perioperative Registered Nurses (AORN), and adherence is crucial for minimizing the risk of surgical site infections. What are the key components of an effective error reporting system in healthcare, and how do they contribute to improving patient safety and preventing future errors? Answer: an effective error reporting system should include confidentiality and non-punitive environment. The system must ensure confidentiality for healthcare professionals who report errors. A non-punitive approach encourages staff to report incidents without fear of retaliation. Clear reporting channels. There should be well-defined channels for reporting incidents, such as a digital reporting system or a designated person team for incident management. Root cause analysis. Once an error is reported, a thorough root cause analysis should be conducted to understand the factors that contributed to the incident. Actionable feedback. The system should provide feedback on the corrective actions taken, allowing healthcare professionals to learn from incidents and apply the lessons learned to improve practices. These components align with HCPC guidelines on continuous improvement and the National Patient Safety Agency (NPSA) principles, ensuring that patient safety is prioritized and improved through structured reporting and learning. What steps can healthcare providers take to reduce the risk of medication errors, particularly in busy hospital wards, and how do these measures comply with regulatory standards set by professional bodies like HCPC? Answer: to reduce the risk of medication errors, healthcare providers should implement the following steps. Medication reconciliation. A process where a comprehensive list of all medications is created for each patient, ensuring that there are no discrepancies between prescribed, dispensed, and administered medications. Double check systems. Implementing a double-check system where two healthcare professionals independently verify the medication order before administration. Barcoding systems using barcode medication administration (BCMA) systems, which ensure the right patient receives the right medication at the right dose at the right time. Staff training, regularly training staff on safe medication practices, including identifying high-risk medications, reading labels carefully, and following established protocols. These practices align with the standards outlined by the Health and Safety Executive, ATESA, and HCP to ensure the safety and well-being of patients during treatment. A patient with a suspected viral infection needs to be transported from the emergency department to the intensive care unit. What infection control measures should be followed to prevent cross-contamination during this transfer according to best practices in healthcare settings? Answer: during patient transport, the following infection control measures should be followed. Use of PPE. Healthcare workers involved in the transfer must wear appropriate PPE, including gloves, gowns, masks, and eye protection, depending on the suspected infection type. Patient masking. If the patient is suspected of having a contagious respiratory infection, they should wear a surgical mask to minimize the spread of respiratory droplets during transport. Clean transport equipment. The transport stretcher or wheelchair should be cleaned and disinfected before and after use as per infection control protocols, minimizing transport time. The transport process should be expedited to reduce the patient's exposure to other individuals in public areas, and transport should occur via designated routes. These measures are aligned with the infection control guidelines provided by the CDC and WHO, ensuring patient and staff safety during transport. What are the potential consequences of human error in medical equipment handling, and how can healthcare professionals minimize the risk of equipment-related mistakes? Answer: human error in medical equipment handling can lead to serious patient harm, including misdiagnosis, incorrect treatment, and delayed interventions. The following measures can minimize this risk: training and competency. Healthcare professionals should receive regular training on the use of medical equipment to ensure familiarity with the operation, maintenance, and troubleshooting. Preventive maintenance. Regular inspection and calibration of medical equipment can prevent malfunctions that may result from wear and tear. Clear instructions. Equipment should be clearly labeled with usage instructions and safety warnings to guide healthcare workers in handling. Error-resistant design. Where possible, equipment should be designed to minimize the likelihood of user error with features like safety locks or automatic shutoffs. These strategies align with HCPC guidelines and ensure a reduction in errors related to medical equipment use.